make recommendations to the government as COVID vaccines are not yet available in the country. But is the government prepared for handling the dangers posed by COVID variants? We discuss in this episode of The Chiefs. Welcome to this Thursday edition of The Chiefs. We start tonight with Doctors Jaime Montoya of the newly formed IATF Technical Working Group on COVID-19 variants. Dr. Montoya is also the Executive Director of the DOST Philippine Council for Health Research and Development. And joining us later will be Dr. Ong-Lim, who is a pediatric infectious disease specialist and also a member of the Technical Working Group. Good evening, Dr. Montoya. Welcome again to the Chiefs.
Yes, good evening, Ami.
Right. Doctor, we're waiting for Robbie Alampay of TV5 to join us later. But anyway, people are now worried about this COVID variant, the B117, no? I mean, we don't really know much about what happened. Ano ba talaga? Because we're basing all our concerns on this story about the Filipina who boarded the flight from NAIA. She went to Hong Kong. She presented a document that she is cleared. So what do we know about it? Did she take a test of the NAIA? Ano ba talaga? Is the reason for us to be worried?
Well, first of all, I'd like to say that the variants or the occurrence of these variants are not something new or unusual. We expect that in time because viruses do change and mutate as they affect more and infect more and more people. So this is not unusual, especially for the RNA viruses of which the SARS coronavirus 2 belongs to. That is why we, even before this, the formation of this group, we already had a project, a research surveillance group that did the surveillance for the genomic characteristics of the circulating SARS coronavirus 2 here in the country as early as 3 months ago. And if you will remember, that is the reason why we were able to detect the occurrence of an earlier variant, which is B614G. And that is precisely because of the genomic surveillance was conducted at that time. It was initially identified in Europe, and Dr. Saloma, the head of the Philippine Genome Center, which does this surveillance, actually reported that we had already the variant here in the Philippines. So we expect that the same monitoring will be done also for this UK variant, and the other variants have been reported in several reports.
Doctor, I think the concern arises from what the experts say is that it's highly infectious. Okay, here's Robbie Alampay coming in.
Good evening, sir.
Infectious, and from what we read in the news reports, it has forced governments, especially in Europe, in the UK, to reimpose lockdowns to prevent the transmission. So is the reason for us to be concerned?
Well, based on the reports coming from the UK, where it was initially identified, and of course the others followed suit, it was proven to be more infectious than the current or the initially identified strain circulating in most of the countries. It's 40 to 70% infectious. That is the estimate of the experts in the UK. And but they are saying, and based on their initial studies, that although it is more infectious, mas nakakahawa, it doesn't have a major effect as far as yung ability to elicit protective antibodies from people who probably recover from an infection or hopefully will be vaccinated by any of these new vaccines coming out. Because the changes, although it affects the spike protein, ito yung part ng virus which enables it to attach to the human cell para makapasok po. And of course to multiply and replicate. Although it affects that particular region, hindi po to major. And since the vaccines actually induce antibodies to the whole spike protein, no? Ang changes kasi na na-identify is only parts of the spike protein, hindi yung buo. We still expect the current vaccines to work.
Okay. But yun ang nga tanong ko, what do we know about this woman who left the Philippines and went to Hong Kong? Did she get it here? Meron na ba tayong conclusive word on that she got it here or she got it in Hong Kong? And do we have reason to be worried?
Still coordinating with the Hong Kong office and finding out the results of the data. I am not privy to that information as of now, but it's being worked out, and we'll know that maybe by tomorrow. So what's the actual status of the infection?
Yeah, but Dr. Montoya, is it a safe assumption if we confirm that she got it here, or at least she had it while she was here, it's safe to assume that she couldn't be the only one. It's safe to assume that it's the variant is already in the country.
Well, yes, that is possible because as I was saying time and again, even without the report of the UK variant a few weeks ago, it is highly possible that this variant can occur anywhere else in the world by itself. It doesn't have to be imported because, as I said, viruses normally mutate. So although if it's reported in one country, we can prevent its entry, especially if we know that there are no reports yet in our country.
Okay. But in the meantime, all our testing capacities don't need to be upgraded or don't need to be updated or changed or revised just for this new variant. All the infrastructure in place is good enough as well to catch this variant.
Yeah. As I said, again, based on the studies that are available and the researches that have been done so far to analyze this particular variant, it may have an effect on the diagnostic side. But the diagnostic kits that we are employing now actually look at different parts of the virus, not just on the spike protein. So again, we do not foresee an impact even on diagnostics. And as I said, we don't also foresee an impact on the efficacy or the effectiveness of the new vaccines that will now be rolled out, hopefully, because the changes are not major and the antibodies induced by the vaccines are actually more broad that will cover most of these mutations.
But at this point, doctor, we cannot rule out that it is already here because that's what Father Nick Austriaco of Octa Research told us last night. Since hindi naman daw kaagad siya na-block, it is possible. We cannot rule it out. He's not saying it's here, but we cannot rule it out.
That's true. But as of now, what we know is that because the time that the travel ban was enforced, the genomic surveillance team already looked at the possible variants because they do this, as I said, even without the report. This group has been monitoring changes in the genomic sequence or the molecular characteristics of the circulating strains here in the Philippines at random. But with the enforcement of the travel ban, they looked at all of the possible cases may have come here. And so far, out of those who came from the UK na nakapasok dito, wala pong na-identify na variant, na UK variant, as of now.
Yeah, but sir, and that's a good point. It's good that you mentioned the travel ban. Every time, every day, notwithstanding, as you said, wala pa naman tayo na nakikita. It looks like it's holding. But every day we get reports of, oh, mukhang itong country na to, idadagdag na rin. Itong country na to, idadagdag na rin. How far do you think we have to go? I mean, will it get to the point that there will be a total ban on flights, or how much further does considering that it could come from not just directly from the UK or Europe, it could come via any transit point. How far will travel bans have to be considered?
Yeah, you know, the strategy to control a new virus, just like what we did when the SARS coronavirus 2 started, is really port control, port of entry control. But once it is actually already identified in the country, the efforts now shift, not just with the air entry control, but also what is being done inside to prevent its spread. And with or without the variant, we really have to be even be stricter with the enforcement of what we call minimum health standards. It really has to be enforced, especially now that we have reports of variants which are maybe more infectious. As I said, based on the current studies that are being done, are actually more infectious than the current strains that have been reported. So we really have to practice the minimum health standards, and that will be, as of now, adequate, short of the vaccine, to prevent further spread.
Okay, if we establish that the variant is here, do we need to tighten restrictions like the other countries are doing? They return to lockdown. So, nang kinatatakot ngayon ng mga tao that we might have to close businesses again, we might have to limit movements again. Is that possible?
The possibility is, and I don't know whether lockdowns should be imposed, but that will really depend on if there's a sudden increase in cases, for example, which is very significant on a daily basis, or if for some reason people are developing more complications, developing more symptoms, more severe symptoms over a certain period of time, more patients are being affected, maybe that will be considered. But as of now, as I said, it is proven to be more infectious, but has no impact so far on severity of symptoms or even severe consequences like death. So it has no effect on those so far.
But as a precaution, do you think we should, for example, make the curfews longer again, for example?
We will be basing it on the reports coming from the Department of Health, the Epidemiology Bureau. As I said, if there are increasing cases, really significant, or clustering of cases in particular areas, maybe that will be done. Because the current strategy is really not to do large lockdowns, but really on focal areas where clustering are identified or unusual increase in cases are reported.
Granular lockdowns.
Yes.
Okay. Dr. Jaime Montoya, Executive Director of the DOST Philippine Council for Health Research and Development. Maraming salamat po for joining us.
Maraming
Thank you,
salamat po.
Doctor.
Thank you.
Thank you.
And we continue our conversation. Joining us now is Dr. Anna Ong-Lim, who is a pediatric infectious disease specialist, and she's also a member of the Technical Working Group. Doc Anna, welcome to the Chiefs once again.
Good evening, Doctor.
Ma'am, you're a pediatric infectious disease specialist. Are there any particular concerns with this new variant when it comes to children?
Well, the reports coming from the UK do say that more individuals under the age of 20 seem to be affected by this new variant. So it's something that we're watching closely.
But is the effect on them still the same? We're reading the reports na mas madaling mahawa pero hindi necessarily mas matindi yung symptoms. Does that hold still for the minors?
Well, there's no data right now that's age stratified, no. So when they talk about being more infectious but not necessarily affecting the severity, this is across all age groups. But Robbie, I think there's something we need to take note of, no. When we talk about this variant not being necessarily more severe, I think it conveys the impression that pwede nating hindi masyadong tutukan. But I think one perspective that we have to take is that because it's more infectious, we're dealing with more people potentially getting sick. And because we have a bigger group of people who will get sick, necessarily you will have a bigger group of people who will have complicated disease and who might die. So what are we talking about in terms of numbers? We're talking about a 9-fold increase in the number of people who might be infected. And of course, the same increase in the number of people who might succumb to the disease.
Ninefold. So what's the first order of business for the Technical Working Group? What is your first task?
So the group was actually convened to monitor not just this particular variant, but also to keep an eye on any changes in the virus biology that might have an impact in terms of how the disease plays out in the community. No? And so, of course, we are trying to monitor all of these people who are traveling in to make sure that we don't inadvertently import a case. But also, the goal is to try to see whether what we have that's already circulating locally might be a variant of concern, not necessarily a UK variant. Who knows, in a couple of days, a couple of weeks, we might have a Philippine variant that can be a
Our
problem.
own. Yeah.
How quickly does that happen? I mean, we understand that mutations, of course, constantly happen. Some could be, I mean, more or less quote unquote benign relative to how it currently behaves. Some could be worse. Some could be not necessarily have any more severe effects. But how quickly, to just to give us an idea, how common and how quickly do mutations actually take place?
Well, I do remember reading through literature that says about 2 months per mutation, but it really also depends on how quickly the disease is spreading. So one of the things we really also need to focus on is to make sure that we keep the cases low. Because the more cases you have, the more opportunities this virus has to change and to evolve and to mutate. So that's part of the strategy actually, so that we don't increase the likelihood that we have more mutations.
Is
In
it
the mean,
possible for the variant to be weaker or to have a longer impact on the patient? Like, because they are reporting some patients are suffering even after they have tested negative already for the test. Is this also possible, this kind of mutation?
So, Ami, actually what you're describing is what they call long COVID or post-acute COVID
Yes.
symptoms, no? So far, that hasn't been associated with a mutation. But I think one of the things we also need to realize is that most mutations don't really impact on the way the virus behaves. They're just these certain mutations that convey a survival advantage for the virus. And those are the ones that we want to take note of. So, for example, this UK variant, no, because it becomes more transmissible, then naturally the virus gets an advantage. It spreads more quickly. The D614G mutation that we picked up several months ago is also the same. It's a little bit more contagious compared to the original Wuhan strain. That's why it's now more prominent.
Ma'am, in the meantime, wala pa nga dito yung vaccine. There's this new variant, and far ahead of all of that, one of the bigger concerns now for government and frontliners is all of this research showing that most Filipinos are still reluctant kahit dumating na yung kung anumang vaccine that we can get our hands on. Filipinos generally, the majority still have their reluctance para magpabakuna and to get inoculated. How would you help the government craft their message so that people can be assured? What would you tell the general public?
In a lot of cases, the hesitation is driven by maybe a lack of information. And so it's very critical to be able to share the knowledge that we have about the vaccines so that people are reassured that they are firstly safe and maybe, and of course, equally importantly, that these vaccines are effective. Also, I think it will be helpful for people to see that people in authority, people who have the background, the scientific background, are also willing to take the vaccine as a assurance that in a way they're putting their money where their mouth is, no? Hindi yung parang pinipilit natin yung ibang magpabakuna pero tayo natatakot, no? So, ganyan nakikita yan ng ating mga kababayan. So, I think it's a combination of modeling, transparency, and also providing knowledge.
The surveys and there have been, I think, at least 3 surveys showing very low, pretty low interest in vaccination among Filipinos, especially in the NCR. What do you think can be done to overcome this vaccine hesitancy, this skepticism?
Well, we certainly have our work cut out for us, no? Kasi syempre, yung 25% na yan, I have to say, it's really not acceptable. But one of the things we need to explore is why, no? I think we have to ask people what they really feel, what they think. We can't assume, we can't make assumptions that the reason why they're refusing vaccines is X reason or Y reason. Kailangan talaga natin silang tanungin para mabigyan natin ng magandang solusyon yung mga problemang pinipresent nila.
Okay. Dr. Anna Ong-Lim will need to take a break, but we hope to keep you here for our conversation. Please stay with us. The Chiefs will be right back. Welcome back to the Chiefs. We're still with Dr. Anna Ong-Lim, a pediatric infectious disease specialist, and she's also a member of the newly formed Technical Working Group of the IATF. They're working on the COVID-19 variants. Dr. Ong-Lim, we were talking about how this new UK variant, as we said, is more infectious. Not only that, we're also taking note of its particular impact to minors, people below 20. Given that, you would agree, I suppose, that it was not only wise, there was really little choice for government but to cancel the planned face-to-face classes.
Yes, no. There was actually an initial plan to pilot some areas for face-to-face classes, but after the issue about the UK variant came about, it was actually decided that this would be put on hold for the meantime. So yes, I think it really was a good idea to just hold these plans for the meantime.
And this now cuts across various LGUs. We were talking to some, particularly Metro Manila mayors over the past week, and I mean, almost all of them expressed on behalf of their constituents that their constituents were particularly apprehensive about vaccine candidates from China. Um, at this point, does the technical working group have any particular recommendations when it comes to the different vaccines coming from different countries?
Well, it's a different team that's working on that, no, Rob.
Mm.
The choice about the vaccines is actually the task of the vaccine expert panel. So they're the ones who are studying the different submission dossiers and looking at the features of these vaccines that we might have available.
Okay.
Speaking of local governments, Doctor, the city government of Manila is preparing for the traslation, the Black Nazarene procession on Saturday. And the Catholic Church people are requesting that they be allowed to increase the capacity inside the church up to 50%. Would you recommend that this be allowed?
I actually had the opportunity to work with a team that's preparing for the translation earlier today. And I have to say that their team is really very well aware of the risk posed by this activity. And their mindset is that they want to be able to contain um, any issues or concerns about possible crowding and possible disease transmission. Now, they actually came out with a press release. I'm not sure whether that's been shared with your team, but basically their call is if it's possible, don't go. But if you still wish to go, then please make sure to practice the minimum health standards.
Beyond these special occasions, I mean, I have to admit, I now go to the office every day. I see the traffic every day. I've been to malls. And notwithstanding the fact na ako mismo nandun, nagugulat ako na maraming tao. Hey, what are you noticing about the general behavior of the population, and of Filipinos that you think needs a little bit of reminding and needs a little bit of just flagging? Are we getting are we letting our guards down?
Unfortunately, yes. No, I think it's really just natural human behavior. You can't always be stressed 100% of the time because our capacity to handle it goes down over time. And our natural response is to, how would you put this, adapt our behavior so that we're not always at this high level of awareness, no, or stress, di ba? Ganun talaga ang coping ng tao eh. So, I think importante talagang ipaalala sa lahat na hindi pa tapos tong problema natin. And I don't know if it sounds alarmist, but really just to share the fact that this new variant is really much more contagious than what we used to have should, I hope, should make people more aware and more willing to put up with the inconveniences.
Yeah.
Doctor,
Well, from the
yeah.
Go ahead, Amy.
Doctor, I posed this question earlier to Dr. Montoya because of the possibility that the variant might actually be here already or it might reach us. Are you recommending any tightening of restrictions on certain sectors, certain areas, certain activities?
It's a really difficult question to answer, no? Alam mo, from the medical standpoint, I would say yes. Diba? Kasi ano ba naman ang, in our line of work as infectious disease specialists, when we have an outbreak, our natural response is contain, isolate, quarantine, and then intervene, like maybe vaccinate if it's possible, so that you decrease the number of susceptibles. That's our framework from the medical mindset. But we also know that this is not all just a medical health issue. There's also the economy to consider. And if it ever happens that we have to lock down, then I think we would have gotten to the point where there was no other choice. Diba? And we don't want to get to that point.
Yeah. And precisely there, Doc, kanina we were talking about individuals, we were talking about ourselves, no? Yung mga friends natin, mga relatives natin, we can understand even as we want to flag each other, we want to flag ourselves. From the individuals, let's move to the establishments and to the public places that people go to. Obviously, a lot of the mechanisms, the controls, the protocols are in place. Everybody has gone much farther than where we were months ago. But notwithstanding that, what else would you recommend that is not yet being done, or at least that can be done better?
I think one of the things that we can do is to make contact tracing more, how should I put this, more convenient. Kasi right now, for example, if you had to go to the grocery, no, and do your essential errands, you would have to fill out this piece of paper or maybe enter your details into your into a QR code so that your data is captured. But there's also a system that allows individuals to be given QR codes, so that's what you present, no? Well, it sounds very technical, but if this thing is going to be with us for a long time, maybe we should be thinking about migrating to systems like that so that people's movements can be tracked more readily, because it's going to be critical for us to identify who may have been exposed so that we can try to advise them to limit their movements.
And that I imagine that becomes even more crucial now with this UK variant that's even more infectious.
Yes, I agree.
Okay. Dr. Annalisa Ong-Lim of the Technical Working Group on COVID variants, thank you for joining the Chiefs. Good evening.
Thank you for the opportunity.
Salamat po.
Robbie, we didn't have a chance to discuss the headlines. Ano ba yung binasa mo kanina?
Well, obviously, like everybody else, we were all riveted by what was happening in the United States.
Sa US.
Diba? So, yung headline talaga, it was really about that chaos. The unfortunate thing for Filipinos is that when you look at it, parang that's nothing new. But when you take it in the context, diba? But when you take it in the context of the United States, one of the oldest, strongest symbols of democracy, for that matter, you can only imagine that for that country and for such an important nation, talagang jarring na makita. We're used to seeing this, di ba, sa iba-ibang bansa. Hindi lang tayo, mga nagsusuntukan na parliamentarian sa Taiwan, sa South Korea, sa Europe, and so on. But the United States, this was really something else.
At saka may namatay. 4 dead. Di ba? Saka pinagwawawasak talaga yung loob ng ano eh.
And then apart from that, of course, people were also monitoring. I mean, on the way here, I was monitoring the press conference of the friends of Christine Dacera, and still that's one of the biggest topics. But there's really two stories there. One was ano nangyari kay Christine. The other story is ano nangyayari sa police, di ba? How they've been conducting this investigation. So that's the other big story today still.
Baka lalo mag-surge yung mga COVID sa Washington as a result of that, ano? Talagang hindi nakamaskara yung mga tao. But anyway, balik pa rin tayo sa COVID ngayon, and we'd like to welcome our next guest, UP Professor Guido David of Octa Research. Good evening, Professor. Welcome.
Prof, welcome.
Yes, hi, good evening.
Hi.
Happy New Year, Annie and Robbie.
Happy New Year.
Happy Tweet Kings. Not very happy. We have a new variant. But anyway, yung research nyo, it showed the high compliance in NCR with the health protocols. Can you tell us more about it?
Well, we did a non-commissioned survey, and we surveyed about 600 respondents in Metro Manila. And what we see is around 93% of them say that they comply with wearing face masks. Of course, this is the sorry. I think 93. I'm pulling up my 93%, around 93%, the NCR. They say they use face masks. Of course, iba yung what they say and what how they wear it. Yeah, kasi yung proper wearing of face mask. Kasi aside from this is a survey, but we actually also did it's like a survey, but what we did, and hindi pa namin na-release to, is we sampled people wearing face masks by looking at pictures. And dito, it's much lower. It's about 80%, I think 75 to 80%. So I don't have the exact number, but it's somewhere within that range. It's in one LGU, sampled over, but I think this was done last October, I think. Hindi pa namin na-release yung results na yan.
So, ibig sabihin niya, there's a 10 to 15% difference between those who say na, nagmamask kami, and then on the other hand, doon sa isang exercise na hindi nyo tinanong, tiningnan nyo lang kung if they're really complying.
Exactly. So, sometimes there's a difference between perception and reality. Kumaga ako, I feel na, face mask naman ako, pero most of the time, nasa baba pala. Then, it doesn't count. But at least, if the 10% is across the board, then that will help us then discern other, survey results, such as cleansing of hands, face shield. Ito, kunyari, avoiding crowded places. 37% lang nagsabi na they do that. So apparently, people, yung pagka-inform sa kanila, what they think is, as long as we're wearing face mask, face shield, and then hand sanitizing, kasi ito yung top 3 na and then physical distancing, they feel na they're okay. Kasi ito yung top 4 na sagot nila eh. And yung pinakamababa doon, yung social distancing, which is about 73%.
That's Paano yung, are you worried about the procession? I asked this earlier. Are you worried about the procession this Saturday, yung sa Black Nazarene? Kasi I think Catholic Church people are doing their best to manage the crowd, no? But pagdating ng mga tao niyan, medyo mahirap-hirap na di ba?
Well, yeah, those mass gatherings are always work. Pero wala naman, we can only watch. We can.
Okay.
Yeah, and I think there are the circumstances.
May problema yung connection ni Professor David. I'm sure he will come back. No, pero I meant to ask him, and I will ask him. Remember, before Christmas, they were really warning na tataas kung
Yes.
in fact we might as well accept na tataas. But if I remember right, yung worst case scenario na pinoproject nila didn't quite happen, di ba? I mean, they're still reminding people yes, exactly. They're still reminding people we're still waiting for the data to come in. Laboratories were not fully open. There's about 30% less laboratories who are opening. And so they're saying maybe a week or 2 from now we'll see the real numbers. But notwithstanding that, and ito na si Professor David.
Welcome back.
Diba? Did it come to pass? Professor, I'll repeat it. Before Christmas, you were already warning everybody, and we think rightly and inevitably na, mag-holiday tayo. It's inevitable that people will be a little bit more lax. People will be visiting their relatives. You were saying, if we don't watch it, tataas talaga yung numbers natin. There's going to be a spike. Now, after Christmas, we understand there's going to be a delay in the numbers, especially because laboratories were not open. But even factoring that in, is it safe to say that the worst did not come to pass? At least the worst that you were warning of in December?
Well, Robbie, we would always be happy to say na the worst did not come to pass. Pero we're not out of the clear yet. Kumbaga, it's too early to claim victory, kumbaga, because yung mga laboratories during the entire holiday period, they were only testing about 50% of capacity. So parang half lang natetest nila. And that's why we registered lower numbers during the entire holiday kasi it's only mga 50%. So itong mga cases na yan, pwedeng naipon sila. And also, anecdotally, some of our colleagues say na may mga kilala sila, nag-contract sila ng COVID during the holidays, pero hindi pa sila nagpupuntang hospital kasi Christmas. Parang ayaw nila mag-holiday sila sa hospital. So parang inano muna nila, tiniis mo nila. I mean, we're not speaking for all of the possible cases, pero there are situations na ganun. Possibly closing ibang hospitals or may reluctance to be admitted during the holiday. So we might see an increase in numbers. We're not guaranteeing this. I mean, we hope we're wrong, pero it's possible na naipon yung mga ibang late cases.
Professor, how worried are you about the new variant? Kasi sabi ni Dr. Ong-Lim kanina, it could be up to 9 times ba more transmissible, more infectious?
Well, yung science for the new variant, I mean, it's all relatively new. So, I mean, it is new kasi September pa lang lumabas yung new variant. So it's difficult to say kung how many times more infectious it is. Pero what we do know is it is infectious. And, well, 9 times more is, it could be. I mean, sasabi ng...
Let me clarify. I think if I understood it correctly, she said what the reports were saying, that it's known to be up to 70% more infectious, and if we don't watch it, we could be facing a 9-fold increase. Not necessarily that it's 9 times more infectious.
Okay, well, that seems more reasonable. Yeah, what I heard is it is 50 to 70% more infectious. And 9-fold would be an extrapolation based siguro sa reproduction number. We're in the process of making our own projections based on what we perceive to be the reproduction number. So this is worrisome, pero at the same time, we do have, I mean, yung weapons natin against this variant would be the same as yung original variant or the previous variant, which is to wear face mask and face shield and do social distancing. Yun naman eh. So even if it's 50% more infectious, pag naka-face shield tayo and face mask, ma-reduce yung 50%. I mean, it could be maybe maging 10% more lang. I mean, it's not clear how these will translate once we have our health protocols in place. Alam naman natin sa Europe, hindi sila ganun ka-compliant with the face mask. They don't use face shields.
Okay. So Prof, even with the 50 to 70%, I mean, how does that work for you, the data scientist? You don't just easily just plug in 50 to 70% into your numbers and then do your modeling that way. What other factors would be important to determining how exactly the impact will go?
Yeah, you're very right, Robbie. So we don't just plug in yung 50%. In fact, yung reproduction number, according to them, they say it's about 0.5 higher than yung reproduction number ng ng previous variant. Previous variant. So we can just plug that in if that were the case. Kaya lang, the reproduction number, alam naman natin, it adjusts pag we're applying the health protocols. So pag nagsa-social distancing tayo, naka-face mask tayo, na-reduce din ang reproduction number. So in short, basically what we're saying is we can't really say how it will evolve while we haven't seen it here yet. I mean, we haven't seen in numbers, or we haven't tested, we haven't sequenced it yet to know na it's in sufficient number dito sa Philippines. We know that it's probably here. In fact, kami una sabi na it's most likely here. I mean, we didn't want to be right, pero we're just basing it on statistics, on probability, na it's more likely to be here. And then it turns out na baka andito na nga because may OFW na galing dito, na-detect sa Hong Kong. I mean, and also probabilities din. It's already in many other countries. Nasa US na siya, na locally, nagka-local transmission na siya sa US. So, it's more likely here, pero we're hoping that even if it came here, it's not in abundance here in the Philippines. So baka na-control natin siya for some reason. So there's a lot of unknown pa, and we have to factor all these things into our models, and we don't really have a way of assessing the evolution of the pandemic habang hindi pa natin nakikita.
Professor, balikan ko lang yung survey nyo. You included a portion of that is about prayer. Can you tell us more about it? Maybe it's related to my question also about the translation.
Yeah. So basically, one of the questions is what do we do against COVID? Parang ganun. I'm paraphrasing. And then they have a list of choices. And so, wearing a face mask is around 93%, like I said. And observing physical distancing is about 73%. There's a choice, which is prayer. So 48% resort to prayer. So ibig sabihin, it's one way of not getting a disease sa perspective ng mga tao. So about 1 out of 2. And then, avoiding crowded places is 37%. And avoiding international travel is 14%. This is low, of course, because most people feel na this is not applicable to me. Hindi naman ako nag-international travel, so I don't have to check off this answer. Kasi syempre, kung may pera, ikaw lang mag-iisip na sagutin yan.
Hey, Prof, linawin ko lang. Yung prayer was in response to an open-ended question, or you provided that option?
It's provided. So hindi siya yung open-ended.
Okay, then I'm just curious, why? Why include the prayer something as, it's a bit more abstract in terms of behavior. It's not scientifically measurable. Let's say at the very least. Why did you include prayer as among the interventions?
Well, I think we just thought of putting something out there na hindi, maybe sort of a less conventional response. I mean, in terms of a scientific response. So we just wanted to see how people would react to this type of, option. If they did.
Yeah, but I mean, not to denigrate it. I mean, certainly we respect people who do that. But when you do get half of the people, we're not saying that's their only intervention. But when it is a sizable amount of the population saying that prayer is one of the most important things that we can do, does that also on the other side potentially flag any concerns about people being over reliant on prayer?
Well, it could be. It reflects also our culture, our cultural perspective, or yung upbringing natin, or yung environment natin, in which we resort to prayer to solve problems. Although these problems can actually be solved by just applying simple measures like yung wearing a face mask. I mean, I would think it's easier to wear a face mask than to and to have prayer. Pero I mean, of course, you can pray. I mean, everyone can pray. Pero it's surprising lang that prayer is higher than avoiding crowded places, which is I think I would tend to avoid crowded places because I'm like that. And prayer is even higher than covering nose and mouth when sneezing or coughing. So it's 48%. So it's about the same as prayer. So if you win 1 out of 2, don't think that covering your mouth when you're sneezing will prevent COVID transmission. And that's actually interesting.
Baka may mga bumahi sa translasyon. Yun ang takot ni Ami.
But still on your survey, you had a survey on vaccine attitudes now. We're talking about mindsets. Pero hindi nyo tinanong, 25% lang are willing to be vaccinated in the NCR. Are you planning to conduct a survey, follow-up survey on the reasons for the vaccine hesitancy?
Yes, Amy, we are actually planning to do exactly that kasi hindi nga nakaspecify yung reasons and hindi rin nakaspecify yung type of vaccine that they might be more inclined to avail kung available ng mga vaccines na to, because we didn't specify yung country of origin. For example, sabi na natin, suppose we have a vaccine that's available and that's proven to be safe, would you have yourself vaccinated? And yun nga, 25% said yes, 28% said no, and 47% the rest said not sure.
So
What
that
about, Well, I'm just curious in terms of interventions that people have. What about homeopathy, alternative medicine? Did your surveys reflect any other things that that Filipinos are turning to?
Well, wala yung alternative medicine. There is a choice na taking vitamins,
herbal.
avoiding people who are ill, 28%. So,
Mm.
consulting a doctor when not feeling well, 20%.
Mm.
So yun yung mga, actually, yun na yan. I think I covered most of them. Na nasa. Staying at home when it is not necessary to go out, 52%. So, I mean, I assume.
But that means 48% are going out when it's not necessary.
Yes, I mean, and they can say na it's for work kasi naka-specified naman dito when it is not necessary. I mean, alam naman natin work is necessary unless they might have misunderstood. So I'm not sure if they misunderstood na, necessary.
Ano kami dito glass half empty kami dito kung mag-gana ko. No, but kanina nabanggit nyo, there's a 10 to 15% difference between the people who say, oh, nagpe-face mask ako, but when you actually look, there's about a 10 to 15% difference. I'm looking at some other things. You notice that people say 73% say we practice physical distancing, but tama ba yung basa ko dito? Only 67% actually regularly do?
Wait, let me check. So yung
Tama
sa physical
distance.
Yes, kasi meron ditong always, most of the time, and 67% always, most of the time 29%. Physical distancing, yes. So nakadistribute siya by frequency. Sometimes 3%.
Okay. It's distinguished by frequency. But my question is, dun sa, similar to what you did with wearing face masks, did you also go out and observe if people were actually doing what they said in the survey they were doing when it came to physical distancing?
Not yet. We haven't done that. So we haven't checked.
Okay.
So, pero,
Given the low compliance, pretty low, huh? Are you recommending interventions? Because I also noticed you're working with certain LGUs, no? What exactly are you doing when you are working with local government units?
Well, we help them calibrate the interventions that they require. Of course, actually sila mismo alam na rin naman nila. So, as far as interventions are concerned, so we just provide guidance. Like where to target these, yung campaign nila. It's more of a, strategic advice that we're giving rather than yung what to do. Kasi more or less yung local government, they know naman what they have to do. So I don't think they really need our advice regarding that.
Yeah, but other than the numbers and knowing where people are and helping them to target, what's from the local executives' perspective and the mayors, what's the number one question that they really want to understand, that they really tap you for? Can you help us understand this?
Yung local governments. Yeah, well, yun nga, it's more of a strategic, like where is the number one question we get asked is, what is the trend? Is it going up? Is it going down? Or what is the likely trend maybe 1 week from now, 2 weeks from now? Do you think? So it's more of a forecasting type. And then number two, yun nga, where do we focus our resources? And then, ayun. Because as far as yung mga surveys, medyo limited yung capability ng surveys na ginawa namin so far. I mean, I'm not saying limited ng I mean, surveys are very good for calibrating, the response, how people are responding to, what the policies are, what the government is telling them to do. So that's important actually, and that's why we plan to have more of these surveys then.
How many LGUs are you working with, Professor?
Right now, about 3. Yeah, in some
Metro
capacity.
Metro
Metro
Manila.
Manila, yes.
Baguio, hindi ba kasama kayo?
Well, we're actually, si Randy is actually coordinating with someone from Baguio, so as far as I know. So, but we haven't directly worked with them as far as, sitting down and discussing strategies and trends.
One final question, Doctor, right? Because we've been hearing this from the different LGUs, particularly we heard it from Makati, we heard it from Quezon City, we heard it from from the Botas. It's not exactly anecdotal, but they're the first to admit also that it's not necessarily the most the biggest or the most scientific surveys, but everybody's saying there's a particular hesitation when it comes to Chinese Chinese vaccines. Do you intend to conduct, or do you in fact already have some idea on the perception of and openness of people when it comes to the different vaccines from the different countries?
Yes, actually, yeah, that should be also included yun nga, this follow-up survey namin. And this is anecdotal lang. I don't have the results or, statistics to back it up, pero based on, kunyari, sa mga comments na nakikita ko when we have these interviews, and there are also people who ask questions. May nag-interview sa akin sa isang station, and the listeners were asking about the type of vaccine. Sinasabi nga nila, kung Chinese, they're more hesitant. I mean, that's what I'm hearing. This is anecdotal, so I don't have the statistics to back it up. But this seems to be the sentiment that I'm sensing from people. So it would be interesting to know if we could put it down to a number. Ilan yung magtitiwala sa, let's say, sa Pfizer, sa American vaccine, and why? Bakit sila magtitiwala sa Western? If, for example, pareho naman silang efficacy and parehong FDA approved, would you still choose this brand over this brand? We know that part of the problem is also some people have this perception that the cost will be a factor to them, especially some socioeconomic class D and E, and that's why they're siguro a little less or a little more hesitant to be vaccinated than A, B, and C. Kasi mas mataas yung yes sa A, B, and C compared sa D and E. So it could be more of perception, information, or yung cost. They might be worried na they would have to pay for these.
Okay. We will await the results of your survey on that, Professor. UP Professor Guido David of Octa Research, thank you for joining the Chiefs, and I'm sure we will have you back again on the show. Thank you. Good evening.
Maraming salamat.
Okay, and that will be all for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. I'm Ami Pamintuan of the Philippine Star.
I'm Robbie Alampay. We are One News.